Can you help me telling people why policy is so important?
Well, the background of most of the people is in academia, they're scientists or clinicians, and we convince ourselves that the latest science will drive innovation. But there is a whole world outside us that sets rules, that is responsible for introducing our innovations into the clinic, that is responsible for the legislation around it. And those people, we need to tell them what we're doing, and we need to tell them in time and take them along on the journey that we have going from innovation to new products in daily care of our patients. The rules change, and there is definite attention, for example, in the European Parliament, how radiation is considered, how radiation safety measures are taken to protect our patients, the caregivers, the public, the environment. And we are the experts on that, so we need to talk with our regulators to emphasize that we are the experts, that we want to help to achieve the goals, that the radiopharmaceuticals that we use are to the benefit of our patients, but also very safe to use, and that we are very happy to work with our regulators to make it both effective, but also cost efficient and also safe.
And this is really what I learned over the past years, is that if you use the proper language, they are listening to you and they are caring what you are saying. But honestly, it's very difficult because we have to learn the medical language, then we need to learn the language for the patient that is different, then we need to learn the proper with the colleagues that sometimes does not understand what we are doing every day, and then we also have another language now that is the one of the policy.
You have to learn the language, but fortunate enough, we now have more and more people interested in it. Also more and more people learning how it works. We have great support in the office to actually get nuclear medicine on the agenda at the relevant tables. And it's for us to capture that moment, but we need involvement. Say, telling ourselves that we're great, it's nice to do, but we need other people to acknowledge that nuclear medicine makes a significant contribution to healthcare and is one of the most innovative medical specialties.
Yeah, you are right. I'm also very surprised that there is still this lack of understanding at the periphery that whatever is decided in the central part, which is Brussels in this case, is very soon affecting your life.
One of the reasons for that, and it takes a long time from concepts being discussed in Brussels and then trickle all the way down from discussing in Brussels, making decisions in Brussels, going to the member countries, getting translated into national law, and reaching the practices that may take 5 years, 10 years before that trickles down the whole system. So I'm totally not surprised that many members think that what happens in Brussels is far away from what...
Stay in Brussels, we say. Stay in Brussels.
Absolutely. And so I'm not surprised that they consider it something not so relevant for them. But it will at one point be relevant, and we be better at the source to make sure that what comes out of it helps us, helps our patients to deliver nuclear medicine in the most appropriate way. And we can't do it on our own, so we need the experts. So it's an open invitation to people to start getting engaged and raise their hand when their area of interest pops up, so that we can tap in a pool of experts as large as possible.
Yeah, because honestly, this way of working of the EU is very interesting because they open call, they ask for interest, they are very inclusive in this sense. They always produce a document and they ask your feedback. And that is, of course, making the process more long and cumbersome. But it's nice that is this sort of very open approach to what a citizen, a society, a regulatory agency is thinking about a certain topic.
You're exactly right. It's where we started 10 years ago. Is we were pretty reactive, so we waited until something was finalized, and then we started thinking about how to implement it. But the fundamental mistake in thinking how these official institutions work is that you think that they overcomplicate things, that they're out there to make your life difficult. That's not at all the case. Exactly as you say, they're very open to consultations, they're very open to discussions. They make their own judgment, but they listen to us. And when you carefully interact, say, you will recognize that they not only hear us, but they also listen to us and make sure that what they produce is not hampering or be prohibitive for what we want to deliver to the patients.
So it's just using the proper wording, as we said, the proper languages.
Do you think that the effort of being more engaged in policy and in working with the Brussels and national regulatory agencies, that helps the board in their discussion about how the field should move?
Wim, I think that no better decision has been ever taken by the board rather than creating the PRAC. I think that the work that we have done in those years, that you have done leading the PRAC, demonstrate how much is important knowing where the field is evolving, also in terms where is the attention of the parliament, for example, which are the topics that they are prioritizing in the agenda. For example, if we would have not been aware of how much the cardiovascular health plan would develop in the future, we would have just been seated waiting a call out. This is not the case. We can proactively plan a strategy to bring back to the community the real value of cardiovascular medicine, which at the end of the day will be beneficial for every patient in Europe, because we can plan investment, we can guide the agenda of our industry, asking them to support where we need, asking them to produce radiopharmaceutical where are missing, and open up opportunities that otherwise we won't be able to take. And also, if you consider the number of educational programs that through EU planned or sponsored project we were able to run. Think about the Radioligand Therapy Academy. That was originated by an Erasmus Plus project where academic centers were engaged, but now it's totally embedded within the SMIT, and we would be able to put it into the next level by involving our community. So knowing what is a priority, it's absolutely key to shape a proper proactive agenda on the board level.
Yeah, and that is what I like about the interaction between the PRAC and the board, is that say we flag what is coming up and we do some deep digging on content and on timelines. But then, say the board can leverage the resource that we have for education, but also in our involvement in securing the radionuclide supply, where it's really been a joint effort of the board and the PRAC to be present at all the meetings where the crucial decisions are being prepared at the EU level. So having the opportunity to see that the work that you do in policy being executed at the board level with new programs, and there is so much more to come. Let's say everybody is worried about workforce. Say we're short on basically everyone in the multidisciplinary chain in nuclear medicine. Not a single profession in nuclear medicine is exempt. It's medics, it's physicists, it's radiopharmacists, chemists, but also technologists, nurses. So everybody is struggling to get the personnel. We know that at the EU level, workforce issues are high on the agenda, and by acknowledging that this is the case in nuclear medicine, and that we have to be aware that if we don't take action, we will run into trouble, not now and not tomorrow, but the day after tomorrow. For that, we need the help of our members, from our individual members as experts, but also from the member countries, where we need to pull together. One thorn in my thigh is that it's still very difficult for us to generate reliable data on infrastructure, on personnel, on the use of radiopharmaceuticals all across Europe. We have huge gaps in our knowledge how nuclear medicine is actually used in the various countries. And I say that is where we can really pull data from national societies who are aware what is happening in the countries, and feed that back to the board and say, hey, there are regions in Europe where nuclear medicine is severely underutilized, and it's for this and this reason. And the EU is receptive for disparities in the availability of healthcare. But we have to get our house in order to do it. So it's a lot of work coming up. And I truly believe that with the board and PRAC teaming up with the rest of our association, can really be the next step where we generate impact even more than in the few years that we've been doing this.
Yeah, because the readiness of the system is not just having a drug in this context. The drug is or the radiopharmaceutical is already very challenging to produce and to get to the patient, but it's just one of the components of this incredible and unbelievable, if you really think, a chain of value that we are putting every day in practice.
The fact that the future of nuclear medicine still looks bright, I think has a lot to do that we are able to have an open mind and diversify wherever needed. And it happens in this community all the time, and that's part of the fun of being in it. And I'm really curious, say, what makes you tick to make nuclear medicine greater again?
This is just the beginning. So we are really here to make the future brighter, and being responsible for the future means also taking the responsibility of standing in the proper setting and the policy, and Brussels is one of these settings. I still see some reluctance, because I say we are scientists, we are doctors. That is not our piece of cake or cup of tea, as we say in English. But honestly, it is, because as we said during this lovely chat, whatever is happening today is affecting the future of the next generation. And since we are sitting now today here, we have that responsibility.